white dress get you right. Should've look good in the moonlight. This pussy nigga so bad, my
Greetings, viewers all over the world. This is your friend and brother ODoctor.ng. I welcome you all back to my channel. If this is your first time of joining us, I highly welcome you. This is your favorite YouTube channel where we teach you nothing but health in the language that you will understand. Today we shall be talking about the causes of breast cancer. The causes of what? Breast cancer. Last time we talked about the signs and symptoms of breast cancer, so we are continuing on that. All right, before we go on, remember some disclaimer. I do not prescribe drugs on this channel. I do not diagnose diseases online, and this channel does not in any way represent or substitute for your doctor's office. So today we shall be talking about 15 causes. All right, but then I have to say this. There is no particular cause or causes of breast cancer that we can lay our hands on and say these are the particular causes. So I would rather use the risk factors for breast cancers. So the 15 of them that you need to watch out for. Number one is sex. Actually, breast cancer is commoner in women than in men. Okay. The reason is because the male breast is underdeveloped. It is rudimentary, whereas the feminine breast is, well developed. And of course, the hormone estrogen that drives breast cancer is a feminine hormone. So, as a woman, you are more at risk of breast cancer than a man. Number two is age. According to the Center for Disease Control (CDC), most breast cancers are diagnosed after the age of 50 years. Personally, I don't think I've seen a breast cancer in a woman that's less than 30. So it is an age thing. Okay, if I have a patient with the same symptom that is 20 years and another one with 50 years, I'll first of all suspect in the one of 50 than before the person of 20. So age is a risk factor for breast cancer. Number three is genetic mutation. The particular genetic mutation that has been implicated is the BRCA mutation. We have BRCA1 and BRCA2. A popular Hollywood actress, Angelina Jolie, is a well-known victim of this BRCA gene mutation, and the mother had breast cancer and she had to test for the mutation, and she was found to have this. So what happened was she did bilateral prophylactic mastectomy. Okay, the two breasts were removed as a preventive measure to mitigate the breast cancer, and of course a new breast was reconstructed for her. Okay, so it's a major, it's an option for those that have this genetic mutation. Number 4 and number 5 is early menarche and late menopause. I will explain. Number 4 is early menarche, 5 is late menopause. I will explain both at the same time. Okay, menarche is the first menses you have as a woman, while menopause is of course the last one. All right. So when you have early menarche, for example, you saw your menarche at the age of 8 years, and then menopause at 55 or 60. Okay, you see there's a wide range of time that you will be exposed to estrogen than someone that saw her menarche at the age of 16 or 15 and then menopause at 40. All right, so that's just that. When if you see your menarche late and menopause early, the amount of time you'll be exposed to estrogen will be shortened, and of course anything that can suppress your estrogen level is protective of breast cancer. All right, number 6 is increased breast density. Okay, breast density is a function of the fatty tissue and connective tissue in the breast. Okay, the more you will have more of fatty tissues, the less dense, while the more of connective tissues, the more dense. Okay, and the more dense the breast, the more chances of of breast cancer, the more chances of breast cancer, and that has been proven by a study published in the Journal of National Cancer Institute. All right. Number 7 is family history of breast cancer. If someone in your family has had breast cancer, of course, you are at risk of breast cancer. And this risk is increased if the person is a first-degree relative, all right? First-degree relative, by here I mean either your mother, your sister, or your daughter. These are your first-degree relatives. Or your brother also. Breast cancer occurs in men, even though it is very rare, all right? Also, family history of ovarian cancer, that's number 8. By the same principle, if you have a first degree relative with an ovarian cancer, you are at risk of breast cancer and ovarian cancer too. That has been shown by a study. In fact, in a study published at Springer, if you have one first degree relative, with ovarian cancer, there is 13% chance of coming down with breast cancer. And if you have 2 first degree relatives, there is 31% chance of coming down with breast cancer. So that's for family history. Then number 9 is radiation therapy. Studies have shown that people that were irradiated, especially in their childhood days, had more chances of coming down with breast cancer than those that were not irradiated. Okay, especially if the irradiation is within the chest region, there is a risk there of coming down with breast cancer. Then number 10 is drugs. Some drugs have been implicated. A typical example is diethylstilbestrol, a drug that was used then to treat miscarriage. Okay, it has been found to possibly induce breast cancer. Also, some oral contraceptive pills. Contraceptives are drugs that we use to prevent pregnancy. Some of them, some of them contain, of course, estrogen, which can induce breast cancer. And also hormone replacement therapy. During menopause, some women tend to have some excruciating symptoms, and because of that, to mitigate those symptoms, they tend to replace the hormones. And the major component of the hormones which they replace is estrogen, and this can induce breast cancer. Number 11 is first pregnancy after the age of 30. Okay, we call it nulliparity. Okay, of course, pregnancy is protective of breast cancer. During pregnancy, estrogen is far much reduced. The pregnancy hormone, progesterone, suppresses estrogen, and of course, you will menstruate, you will ovulate, and then estrogen level is reduced. So pregnancy is quite protective. And number 12 is not breastfeeding, by the same principle. Okay, if you are not breastfeeding, you will not benefit from lactational amenorrhea. Lactational amenorrhea means you are lactating, you are breastfeeding, and of course, because of that, you won't menstruate. Okay, when you are breastfeeding, it suppresses ovulation and of course menstruation, and that also suppresses estrogen and suppresses the chances of breast cancer. Then number 13 is alcohol. Alcohol has been found to, of course, increase estrogen level and also increase estrogen receptors, and these can induce breast cancer. Then, of course, the next one after alcohol should be what? Smoking. Okay, smoke over 60 carcinogens has been found in tobacco smoke. All right, and smoking is a risk factor for several cancers, most especially bladder cancer, lung cancer, liver cancer, and the breast has also been found to be included. Okay, so excessive intake of alcohol is not good. All right, just have it like that. Then the final one is night shift workers. People who work at night, for example, flight attendants and nurses who do night shift works, have been found to be more at risk of breast cancer than those that do not do such. All right. However, the researchers also found some confounding factors that we are not explained. Just know that these are risk factors and not causes. All right. There are those that have come down with breast cancer without exhibiting any single, of these things. Why there are those that have exhibited all of them and yet did not still come down with breast cancer. So it's just a risk and not, a cause. So just in case you find yourself in any of these categories, that is not a cause for you to panic or to fear. It's just a risk factor. It's not a certainty. All right. So I believe that I've offered you some value. If you think I've done so, please kindly subscribe, share, and drop a comment. Let me know how the thing is going. I still remain your humble friend and brother, ODoctor.ng. Thank you for banking with us.